There is a silent threat, one that could be growing inside the one you love most. A danger that doesn't announce itself with a loud noise or a cry for help, but with a quiet, gradual whisper. You see them every single day. You know their every look, their every habit, their every joy. But what if you're missing something? Something vital. This is a story that every single loving pet owner needs to hear. It's a guide to understanding the silent guardian that protects your best friend, and it's a warning about what happens when that guardian starts to fall. I want you to think about your companion, the one who greets you at the door, whose presence is just this constant comfort in your life. Now ask yourself this. What if the greatest danger they face isn't something out in the world, but a quiet battle being waged inside their own body? What if the clues are right there, right in front of you, but you're just dismissing them as an off day? We've all done it. Oh, he's just tired today, or she must have eaten something funny. But what if it's more than that? What if these are messages you just can't afford to ignore? Today, we're going to pull back that curtain on this hidden enemy. You know, to really understand the threat, we first have to understand the hero of this story, the liver. And it's so much more than just an organ. It's the body's powerhouse, its central command center. I want you to think of it like a tireless, silent guardian standing watch at the gates of your pet's health. It decides what's safe to let in and what has to be neutralized and thrown out. Every single meal, every treat, every medication, even the water they drink, it all has to pass through this vital protector for inspection. Its health is, quite literally, the foundation of your pet's entire well-being. But just how deep do its duties really run? Well, this guardian isn't just some simple filter. No way. It's a sophisticated factory and a master regulator, performing this symphony of crucial tasks 24 hours a day. Let's look at this list. First, it meticulously filters out toxins. This includes things from the environment, sure, but also things we give them with the best intentions, like common anti-inflammatory drugs for arthritis. The liver has to process all of it. Next, it produces bile. That's the stuff that's absolutely essential for breaking down fats and absorbing nutrients. Without it, your pet just can't get the good stuff from their meals. It also creates the very proteins that stop a simple cut from becoming a disaster, the clotting factors. It manages energy by controlling blood sugar, preventing those dangerous highs and lows. It carefully stores a whole stockpile of life-sustaining vitamins like A, D, and E. And finally, and you're going to want to remember this for later, it produces a protein called albumin, which is the key to maintaining fluid balance within your pet's body. I mean, each one of these is a full-time job, and this guardian does them all. So what happens when this tireless worker gets overwhelmed? Even the strongest guardian can be overwhelmed, and when the liver starts to struggle, here's the scary part. It doesn't shout for help. It whispers. The first clues are so subtle, so easily missed, and they're often mistaken for something else entirely. Learning to hear these whispers is the first and maybe the most critical step in solving this mystery before it turns into a crisis. You know, it starts so simply. Your normally ravenous companion, the one who does a happy dance at the sound of kibble hitting the bowl, is suddenly less interested. Maybe they sniff their food and walk away, or they eat only half before wandering off. It is so easy to brush this off, isn't it? Our minds immediately search for simple explanations. Oh, they're just not hungry. They're being picky today. But this subtle change, this decreased appetite, could be the very first whisper from a liver that's under strain, a quiet signal that its immense workload is causing this systemic feeling of just not feeling right. And right alongside that waning appetite, you might notice a change in their energy. That favorite ball doesn't seem quite as exciting anymore. The desire for a walk isn't as urgent or as joyful. They just seem content to lie around. It's not some dramatic collapse. It's a slow fade, a quiet lethargy that settles over them like a heavy blanket. And you might tell yourself they're just getting older, or maybe they're just tired from yesterday. But this could be the powerhouse dimming, the guardians struggling to manage energy stores and filter out those toxins, leaving your pet without the fuel they need to be their vibrant, happy self. How can you tell the difference between a tired pet and a sick one? Okay, now we get to symptoms that are unfortunately all too common for us pet owners. An occasional upset stomach, a little vomiting here, some diarrhea there. We usually chalk it up to something they eat on a walk, right? A dietary indiscretion. And sometimes that's all it is. But when it becomes a recurring pattern, even an infrequent one, you have to look closer. When once in a while becomes once a month, it can be part of a larger, more sinister puzzle. Another clue that the body's central processing unit is malfunctioning, struggling to handle the very food it's supposed to process. This is a clue you might only find by touch. Now, the liver is a big organ, and it's tucked away safely under the ribcage, mostly on the right side. So next time your pet is all relaxed and lying with you, you can gently press on the upper part of their belly.
If they flinch or seem uncomfortable or even just tense up their muscles in that area, that is a really significant sign. Pain is a clear signal, and tenderness in this specific spot could be the guardian itself, swollen and aching from its silent, relentless battle.
So here's the crucial point. Individually, each of these signs is vague. They are so easily explained away. A picky eater, a lazy day, an upset tummy. But when you start to see them together, when a pattern starts to emerge from the noise of daily life, you have to stop and ask yourself this question. Are these just off days, or are they the first faint whispers of a deeper, more serious problem that demands your immediate attention? Because if you miss the whispers, you will eventually have to face the scream. If those whispers go unheard, the disease will progress. The guardian, overwhelmed and damaged, can no longer keep the secrets of its struggle. The clues, they're not subtle anymore. They become alarming, undeniable signs that something is terribly wrong. This is the stage where the truth simply can't be ignored. Remember albumin, that critical protein we talked about that the liver produces to manage fluid in the body? Well, when the liver is severely damaged, it just can't make enough of it. The result is a condition called ascites. The delicate balance of pressure is lost, and fluid begins to leak out of the blood vessels, pooling where it shouldn't. Most often you'll see it in the abdomen, causing a swollen, bloated, pot-bellied look. You might also see the swelling, which is called edema, in their paws and legs. This isn't just a symptom, it's a physical sign of a system in profound crisis. And then comes the most unmistakable and maybe the most frightening sign of all, a condition called jaundice. A healthy pet has clear white sclera, that's the whites of their eyes, and healthy pink gums. But the liver's job is to process a substance called bilirubin, a yellow pigment from old red blood cells breaking down. The liver clears it out. When the guardian can no longer do its job, bilirubin builds up in the body, staining the tissues a ghastly yellow. The difference, as you can see here, is it's just stark. It's a visual alarm bell that the body is being poisoned from the inside out. The source material puts it so plainly, with a chilling clarity that leaves no room for doubt. You're going to see this yellowing. It's no longer white. When you see this, when you lift your pet's lip and see yellow gums, or look into their eyes and see that jaundiced color where there should be clear white, you are seeing a critical sign. This is not a whisper anymore. It is a scream for help, and it's signaling that the danger is already severe and the time for just watching and waiting is long gone. Seeing these signs can be absolutely terrifying. It can feel like the end of a mystery and the beginning of a nightmare. But it is not the end. This is the moment where fear has to turn into action. The reveal of the problem is also the reveal of the path forward. Once you know what you are fighting, once the enemy has a name, you can begin the journey away from diagnosis and toward hope and healing. Okay, let me be absolutely clear about this. Before you try any remedy, before you change any diet, the first, the most critical, the non-negotiable step is to see your veterinarian. They have the tools to run blood tests, to perform exams, and to give you a definitive diagnosis. They can tell you the why behind the symptoms. This professional diagnosis is the bedrock of any successful treatment plan. Searching for answers online is not a substitute. Self-diagnosing is not an option. Professional guidance is everything. Now, once you have that diagnosis and you are working hand in hand with your vet, you can begin to explore some powerful, natural allies to support the liver's recovery. These 5 remedies, they're grounded in both traditional use and modern study, and they can become invaluable tools in your pet's corner. Think of them as reinforcements, arriving to help fortify the guardian as it works to heal itself. So our first ally is milk thistle. This isn't just a supplement, it's like a bodyguard for the liver. It's been studied extensively, and it's shown to work in 2 incredible ways. First, it actively stimulates the liver to repair itself, encouraging the growth of new, healthy cells to replace the damaged ones. Second, it forms a protective barrier around the existing cells, helping to block toxins from causing even more damage. So it's both a builder and a defender. As a general guideline, the recommended dose is about 100 milligrams for every 10 pounds of your pet's body weight, given daily. But always confirm this with your vet. Next up is SAM, which is short for a much longer name. This is a compound that's naturally in every cell, but it's especially concentrated in the liver, where it fuels many of its most critical jobs. When the liver is damaged, its natural stores of SAM just get depleted. So supplementing it is like bringing in fresh reinforcements to a tired army. Studies show it can promote and speed up the regeneration of liver cells and, remarkably, can even help reverse damage caused by certain medications. The typical dosage guideline here is 50 milligrams for every 10 pounds of body weight each day.
Our third ally, curcumin, is the active compound found in the spice turmeric, and it is a master of defense. A lot of the damage that happens in liver disease comes from this relentless process called oxidative damage. The easiest way to think of it is as a kind of cellular rust. Well, curcumin is a powerful antioxidant and anti-inflammatory. It basically swoops in and neutralizes the damaging molecules that cause this rust, protecting the precious liver cells from this constant silent attack. A typical dose of a bioavailable curcumin supplement is about 250 milligrams per 50 pounds of body weight daily. Dandelion root might be a common weed in your yard, but for a struggling liver, its root is treasure. Studies show it has protective qualities against certain toxins, adding another layer of defense for our guardian. But it has another, equally vital benefit for a sick pet. It acts as a mild appetite stimulant. And as we discussed, a sick pet that refuses to eat, well, that's a massive, dangerous barrier to recovery. Dandelion root can gently nudge them back towards their food bowl, which is such a critical first step on the road to healing. The tincture dose is typically half a milliliter per 20 pounds of body weight twice a day. This brings us to our fifth and final ally, slippery elm. And while it doesn't act on the liver itself, its role is profoundly important. Liver disease often causes significant nausea and digestive upset. A pet that feels sick will not eat, no matter how tempting the food is. Slippery elm is a gentle, soothing herb that, when you mix it with water, creates this gel that coats the entire digestive tract, calming nausea and providing immense comfort. I cannot overstate this. The single most important principle in healing is getting your pet eating again. Slippery elm helps make that possible. A standard dose is one 400 millibar capsule per 20 pounds twice daily. We began this journey in the shadows, talking about a hidden danger. We've unmasked the clues, from the faintest whispers to the most alarming signs. We've faced the truth, and we've discovered a clear path toward hope. And now we arrive at the heart of the matter, your role in this story. And it's a role of profound responsibility and even more profound love.
Let this be your final takeaway. Protecting your pet's liver, watching for those subtle whispers, listening to what their body is telling you, and taking swift action when you see the signs. This is more than just treatment for a disease. It is the ultimate expression of your role as their guardian. You are their advocate. You are their protector. You are their voice when they cannot speak for themselves. It is the highest duty that comes with the sacred privilege of their unconditional love.
If you love dogs and found this guide helpful, please join the Charlie's Paw family. We've got more tips, tricks, and plenty of adorable moments coming your way. Don't miss out. Subscribe now to continue learning how to be the best guardian you can possibly be. Thank you for watching.